Good afternoon. My name is Pam Day. I'm going to be doing a head-to-toe assessment on Nevada Courtney.
Yes.
And I do have your permission to do
ma'am.
this. Very good. I am going to wash my hands and get all nice and clean. First I'm going to do the chest. And her chest looks no scars, no lesions, nice and pink. And no cyanosis, no retractions. Now I'm going to do the AP and lateral dimensions. Very good. Very good. And it's 0.7, which is perfect. She is not barrel chested. I'm going to inspect her trachea and the substernal notch, suprasternal, angle of Louis, and the costal angle. So I'm feeling it's midline, no bumps, no masses. Substernal nodule, angle of Louis, and the costal angle. And it's at 45 degrees. I will palpate for C7 through T1, and it's nice and in line. Now I'm going to check for tactile femoris. I'm going to the back, and we will be palpating. This is tactile femoris. Could you please say Mickey Mouse?
Mickey Mouse.
One more time.
Mickey Mouse.
And there's no fluid and no emphysemic changes. Now we're doing palpate for thoracic expansion. And take a deep breath in, please, and out, and one more time. And it is symmetrical and good. Now I'm going to start with the lung sounds. And I'm going to percuss. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And if you'll raise your arm. 11, 12, 13, 14, 15, 16, 17, and 18. And I'm moving to the front. And to finish the percussion, I'm doing 19, 20, 21, 22, 23, 24, 25, and 26. And they're hollow and long, and intensity is loud. Now I will auscultate. While I'm listening, if you'll take deep breaths through your mouth, I appreciate it. Deep breath. This is bronchial, bronchial vestibule, and vestibule. Bronchial, bronchial vestibule, and vestibule. And there are no adventitious breath sounds. Now, I would like you to repeat after me. One, two, three, ABC.
1, 2, 3, ABC.
And again.
1, 2, 3, ABC.
Very good. Now let's whisper.
1, 2, 3, ABC. 1, 2, 3, ABC.
And there is good clarity and loud bronchial and whisper pictology. No, I didn't say that right. All right, I'm going to inspect the heart at this time. Could I get you to lift your left arm, please? And I'm going to inspect the apical pulse, and it is visible. No scars. You gotta lay down. Now I'm ready to palpate for the pericardium. I'm going to start with the apex. Now it's the sternal border and the base. And everything palpates fine. Now I'm going to palpate the point of maximum incalls, the 5th intercostal space mid-clavicular, and it is gentle and brief. Now I'm going to listen at the base of the heart. With the flat hand, and the thrill is palpable. I'm going to palpate the carotid artery. And it's strong. Okay, now I'm going to percuss the heart. And go 1, 2, 3, 4, 5, 6, which is extra. Then I will auscultate the heart for the different valves. This is the aortic, pulmonic, and the second pulmonic area, tricuspid, and this is the mitral valve, or the apical part of the heart. And her rhythm is regular. Okay. There is visible pulsation of the carotid arteries, and there is no jugular venous distension. I'm going to auscultate the carotid and there is no bruit. All right, peripheral vascular inspection. There is no edema present, and she's warm, and the color is good. I'm going to palpate the brachials, the radials. Could you extend your feet out, please? Popliteal, posterior tibial, and the dorsal pedal. All pulses are strong. Now we're going to perform the Allen's test. Okay, can I get you to 5 times? Hold close. Open. And we blanch to nice and pink. Now her eyes. Her eyes are symmetrical. Texture is soft. I see no edema and no lesions. Can you close your eyes? No masses are felt. Open your eyes, please. Conjunctive is clear. No exudate. No nodules. Okay, we're going to delay on the corneal response because of discomfort, since obviously she is neurologically intact, and there will be a corneal response. Pupils are equal and reactive. The sclera is white and there is no edema. Okay. Will you cover your right eye, please? I'm going to cover my left eye. You tell me when you start seeing numbers.
2, 1, 1, 3.
Very good. Her iris is green and she is symmetrical, shape is round. Swing test, we will do again. But we're going to do it just this because I don't know what I did with my pen. Very good. Oh, there it is. Sorry. It is not turning on because I go the wrong way. Don't laugh. Okay. And there is construction of the pupil. No Marcus gun pupil. All right. Will you look at a distant object? Look away. Look at my pen. Very good. The pupils constrict. The optic nerve is in place. All right, let's do our little Snelling's chart. Cover your left eye, please. Read the first line, or the first line the last line that you can see best.
LTFPH.
Very good. Cover the other eye.
LTFPH.
LTF. Very good. 20/20 as far as I can tell. Okay, optic nerve is intact. All right, I already palpated the interorbital rim. The puncta is slightly elevated and all the margins are in place. Now we're going to check the extraocular muscle. There, there, there. Very good. Medial. That checked the inferior oblique, the superior rectus, the lateral rectus, inferior rectus, and that they are all intact muscle-wise. All right, I'm going to direct a light at the bridge of your nose 1 inch away. And then you look, whoops, I'll stop it there. And look away and look back. Very good. Both eyes do converge. Her ears are symmetrical. And they are mobile, and I'm going to palpate the mastoids. And they recoil. And are you having any pain with this?
No.
There's no edema. Okay, will you place your hand over one of your ears, please? You may pick. You can tell me. What am I saying?
4, B, 8, C.
Very good. Let's do it on the other ear. 4.
4,
Whisper. B.
8,
C.
C.
Very good. Hearing is greater than 50%. Now we're going to look at your mouth. Could you open your mouth, stick your tongue? Oh, very good. You got a good gag. Her uvula is pink. There are no lesions. Her mouth looks intact. Tonsils are pink. No lesions. Tongue is pink, and she does have a good gag. Now we will palpate the lymph nodes and the thyroid. Any pain? No pain. And no masses. Okay, will you cover one of your nostrils? Okay, let's see how that olfactory works. Of course, she has a cold. Do you smell anything?
Vanilla.
Very good. All right, let's check the other side. I'm sorry.
Okay. Vinegar.
That's an easy one.
Yep.
Okay. Can you raise your shoulders up? Then down. And your spinal accessory nerves are intact. Okay. Will you repeat after me? We're going to check your coordination and your fine motors. Could you open your eyes, please? Thank you. All right. Very good. Very good. And her fine motor skills are intact. All right. Here. Okay. All right. Can you put your finger on your nose? Touch mine. And switch hands. Very good. Rapid and smooth. Okay. Now we're going to do the Romberg. If you'll stand, your feet together, then close your eyes. Okay, good. You may open your eyes. Could you take 2 steps forward and back? Very good. Gait is intact. And she has no loss of balance. All right. Now, if you'll close your eyes, and we're going to see how sensory function is. All right. Close your eyes and tell me if this is blunt or sharp.
Blunt.
On the which side?
Left. Sharp. Right.
Very good. She does respond to pain. All right. Keeping your eyes closed, I'd like you to tell me what sensation you feel.
Blunt. A cold.
Try again. My water got warm, didn't get warm.
Sorry.
That's okay. Now close your eyes. And tell me the sensation.
Cold.
There we go. There we go. Okay. May I hold your hand? Close your eyes. Tell me which way I'm pushing your thumb.
Down. Up.
Very good. Sensory function is excellent. All right. Now close your eyes again. I'm going to take your hand, replace an object in it. Tell me what it is.
Coin.
Very good. Stereoagnes. And I know I didn't pronounce that right. Okay. Extinction phenomena. All right, tell me where I'm touching you.
Left arm. Right arm. Left upper arm. Right upper arm. Left hand.
Very good. Intact. All right. And we've already done the grafted thesis. And we've done the 2-point discrimination. And now we're going to do reflexes. And we're going to do the plantar. May I have a foot? All right. Very good. And the other foot. Very good. And there is no Babinski. Okay, now we're going to do deep tendon reflexes. I'm going to take your hand. And we're going to do bicep. Very good. Very good. And now we're going to flex the arm 45 degrees. We're going to check the brachial radius. Works well. Very good. And the triceps. Here we go. Here we got movement. And her reflex are intact. Let's try that on patellar. There we go. There we go. And the reflex is intact. We're not doing the clonus on you.
No.
All right. Due to her bone spurs and Achilles tendonitis, we will not be doing the ankle clonus. Okay, I'm getting ready to switch the abdomen. Now we're going to do an abdominal assessment. I'm inspecting it, and it looks like it's all intact. Everything's all right. Could you hold your breath? Take in a deep breath, and out. No hernias. All right, now I'm going to listen in all 4 quadrants to see her bowel sounds. And they are present. I would go lower, but due for this video and the privacy of the patient, it will not be done. Okay, I'm going to percuss. Very good. This would be the spleen, this is the liver, and the stomach. All right, I'm going to lightly palpate. Please tell me if this causes any pain. No. Okay, no lumps are felt. Now we're going to check musculoskeletal and range of motion. Now we're going to check your range of motion and your musculoskeletal. Can you let get my hands squeeze me? All right, let go. Just do what I do. Can you do this? Can you lift your arms? Do circles? Very good. Can you lift your legs? Can you bend there you go, wonderful. All right, lift your thigh up, push up against me. Very good. Now let's check your arms. Now, don't let me push you down. Very good, and it is a 4. Her range of motion is intact, and she has got very good musculoskeletal skills. This concludes my head to toe assessment. Thank you.